Good afternoon, early evening, everybody. Thank you for joining our session with Physicians for Criminal Justice Reform. My name is Dr. Sarah Benson. I'm an Atlanta-based child and adolescent, adult, and forensic psychiatrist. And I'm joined by some of our leadership from the Physicians for Criminal Justice Reform, Dr. Christopher Hoffman, who's an Air Force psychiatrist, and Dr. Kristen Huntoon, who's a neurosurgery fellow at MD Anderson Cancer Center, and who is in charge of social media for PfCJR. So what we'll do today is go through a brief introduction about the organization Physicians for Criminal Justice Reform, some of the ethics that have driven the organization's creation and goals. And then from that, we'll have a discussion about how we as health professionals can be a part of the solution in addressing the much needed reforms in the criminal justice system. So I'm going to share our slides with you. And Dr. Hoffman will get us started.
Oh, Dr. Huntoon, she's going to start us off.
Oh, sorry. Dr. Huntoon will get us started.
Okay, I will start. So Physicians for Criminal Justice Reform may be a little bit of an interesting group, and hopefully we will convince you as to why this is so needed. Next slide, please. Change where everyone's pictures are. So the objectives, just want to go through, which probably are pretty clear, but always good to go over, is to understand why healthcare providers should be an active part in criminal justice reform from an ethical standpoint, and describe how healthcare providers' skill set makes us uniquely qualified to advocate for criminal justice reform, which we'll get into a little bit later on, and then as well as to describe ways in which healthcare providers can affect criminal justice reform. Next slide, please. So these are all haunting images and names as to even just the small amount that's actually brought up into the media. But we've all heard of these names and think about them and their families a lot. And was kind of one of the motivating forces for Physicians for Criminal Justice, was just seeing that this was happening at such an alarming rate, and what we could do about it as physicians, instead of just talking to other people about it, how we could actually influence change in it. Next slide, please. So Physicians for Criminal Justice Reform was carved out by two individuals who unfortunately are not here, Nzinga Harrison and Ajay Nudum, and they made this 501c3 organization. Both of them are physicians, and they were struck by the pyramid of ways that negative encounters with criminal justice has led to detrimental health consequences, which we can go into each of our experiences that we've seen, and then believing that changing the interaction between criminal justice system and individuals of targeted populations will ultimately lead to improved health of targeted communities, as well as physicians advocating to eliminate damaging health consequences that can result from negative interactions with criminal justice system. Next slide, please. So medical ethics. This is such a broad topic.
Oh yeah.
And Nzinga does such a good job going over this. That there's autonomy, non-malice, benefits, and justice. So the patient has the capacity to act intentionally with the understanding and without controlling influences that would mitigate against a free and voluntary act, as well as a requirement that we not intentionally create a harm or injury to the patient, either through acts of commission or omission, and a duty to be a benefit to a patient, as well as to take positive steps to prevent and to remove harm from the patient. And then lastly, justice, a form of fairness, or as Aristotle. Oh, Chris, go, sorry.
All right.
I couldn't remember who was doing the slides.
So the medical ethics part, this is where we get into why we believe physicians should get involved and why we, you know, why we should be impelled to get involved, right? So we are, through our medical ethics, we sort of, through our experiences, we know that these kind of ensure that, you know, patients are safe and that patients have the best outcomes, hopefully, right? We do everything in our power to make sure that we do, you know, do right by the patients. And so we go through these, we make sure that we practice ethically, remembering these principles. And I don't know about you all, but I kind of liken our field to the criminal justice field as, you know, they are supposed to keep the people safe, and they are supposed to be experts out there at making sure that they get to where they are, you know, that even the criminals, so to speak, they are kept safe as well as the people. It's not just about this person doing a crime, so they should, you know, be locked up by any means necessary or any force necessary. But you know, they are people too. Everyone should be safe. We should be making sure that people's health at the end of the day is kept in tip-top shape. So, and then we understand the research and we believe in research. So these are reasons why, you know, we should get involved. So our practice with autonomy, again, autonomy is that you know, right to choose for patients, you know, the capacity to act intentionally. As long as a person has capacity, we've all evaluated for capacity before, have some experience evaluated for capacity. So if they're with it, then they act intentionally with understanding, so that informed consent and without controlling influences, the coercion piece of that, that would mitigate against a free and voluntary act. And so I think about, you know, is it okay for us to treat a person by any means necessary? Probably not. If I want to do something to someone just because I know it'll help them, can I just go in there and do it? No. Should police, or not just, well, should police be able to just arrest anybody by any means necessary? Probably not. To me, at least, it seems a little bit unethical for them to do that. Yes, they have a job to do. Yes, they should arrest, but by any means necessary, if someone takes off running, you know, should they shoot them? Probably not. Let them go. You can find them later. You know, that's how I think about it anyway. But you know, so the autonomy piece, we sort of understand, and we do it for the reasons that we understand that patients do whatever they have to do for themselves. And so when thinking about the criminal justice system and autonomy, autonomy in the criminal justice system is almost non-existent, right? So in our criminal justice system, we believe in order and obedience. And so when we see, well, not a lot of time, well, not all the time, I'll say, but a lot of times we see interactions like this. It starts off as an obedience type of thing. You need to do this, you should do this, or this is the consequences and punishment and all that kind of stuff. And as physicians, we know what the research is about punishment. And so it gives us this one up on understanding research and all those things. And so we get involved. Non-maleficence, excuse me. So that this is where we don't intentionally cause harm through acts of commission or omission. And so we know that something is causing harm, and we're not sitting back and letting it happen, right? So if you're over a patient and someone else is doing something that you know will cause harm, do you sit back and be quiet, or you jump in and say, no, let me help, or let me do something so that the harm isn't caused to your patient? 9 times out of 10, you're going to jump to the patient's safety. Same thing here, but on a much broader scale, right? So we have all these people who have this interaction with the criminal justice system or are incarcerated. We should well, our morals or maybe even our ethics should compel us to act on their behalf, at least through advocacy, beneficence. That is where we should do good or provide the least harm. Again, here we know the research with the criminal justice system and ways to best have some of the best outcomes. So it's good for us to speak out against things that may be causing harm in the criminal justice system. We know, again, punishment isn't the best way to go. We know sometimes solitary confinement, how it works, isn't good for everybody. So everybody shouldn't be thrown in there. You know, even in the criminal justice system, when you have healthcare visits and things like that, just because a person is deemed a criminal doesn't mean that they don't get the care they should receive. And so we should be the people who are advocating for the best care, even though that somebody is a criminal for all intents and purposes. And then justice, and that's pretty simple, the fairness, right? So again, making sure that people are treated correctly, people are treated like human beings. And a lot of times we just do not find that in the conditions of our prisons, in the way that people are treated. And a lot of times it's done to certain communities more or less. So yeah, next slide. And so PfCJR, our core issues, decriminalization of mental health and addictive disorders. So we have various task forces that do these. One of the ones is a mental health task force. And the second one is juvenile justice task force. I think we recently changed the name of that task force, but this is to reform the juvenile justice system to identify and divert at-risk youth and adolescents. And then we have our, and can't even think of it right now, but we want to make sure that people in prison are getting the care that they need. So provision of adequate access to physical and psychiatric health care for current inmates.
Yeah.
And then the last one is, I'm sorry?
I think it's called mental health in prison now, that one.
Yeah, okay. And then the last one, violence prevention task force. And this is the last one that we added on a few years ago, but reduction of violent encounters between law enforcement professionals and the general public. And so through these issues is how PfCJR tries to get involved and advocate for our patients global. I mean, kind of in the United States, they aren't directly our patients, but you know what I mean. Yes, so we'll move on. So, and that's pretty much it. That's our commitment. We try and make sure that we are speaking up for people who cannot, speak up, right? So these people who are involved in the criminal justice system, they aren't always able to speak up for themselves. And so here we are with this sort of expertise. And also we have a platform. Having the MD behind your name gives you a little bit more authority, not authority, so to speak, but it gives you people to listen to the doctor, right? We're supposed to have that information. And so if we do show up for someone, if we do show up at our local legislative meetings and things like that, maybe they'll listen just simply because, we're a physician and we understand things like that. And then as, I'm a psychiatrist, I understand a lot of things about behaviors too. So maybe I can advocate on that level too. So our commitment is to advocating for those who really cannot so much. So next slide. All right. All right, so basically, increase awareness and knowledge in a bi-directional relationship between health and the criminal justice system. We also should serve as a fund of knowledge, education, and training for local, state, and national health and justice systems, and lobby for criminal justice reforms surrounding our core issues. So again, we are supposed to be educating, we're supposed to be speaking up for those who can't necessarily do that through these ways. All right. Dr. Vincent, is that you?
All right, so some of the ways that we do this work or attempt to do this work are through research promotion, education and awareness, political advocacy, and partnering with like-minded organizations. So while we understand that we do have a perspective that can be helpful in this work, we know that this is something that is a multidisciplinary, multi-systemic issue, and that it can't be something that is led with just physicians, and that we have a piece of the puzzle, but certainly not all of it. And so partnership is a huge part of our model and our approach to advocacy. Of course, we always want to think about being data-driven. We know that that helps us when we go into legislators' offices or when we're advocating for systemic change. And so that research promotion is a key part of that because we do rely on having an evidence base when we're having these discussions. Education and awareness, that gets to what we're doing today in terms of just outreach and making sure that people are aware of the organization, what our goals and what our objectives are. And it all comes back to political advocacy. So we do realize that this is a big issue. We realize that advocacy takes time, but we also know that there's only so much that can be done with just protests or editorials, that the goal of those things is that it eventually translates into changes in how systems work. And that requires changes in the laws, protocols, and structures that govern those systems. And so advocacy is a big piece of that as well. So we know that there are ways that social norms and that the social narrative shape policies and shape the way that systems operate. And so we do see lending our voice to different media outlets when we can be helpful, or when a physician's perspective can be helpful, is a part of the solution. It's not the entire solution, but we do know that before we can get the public will or the political will to move things in a way that's more equitable, to move things in a way that respects and that honors the ethics that we say that we believe in as physicians, that it requires a change in the narrative and in the stories that are told, and in who gets to tell those stories, and what aspects of those stories are highlighted. And so that is part of what we look to do as well. And we've been able to have some op-eds and different media articles published in furtherance of that goal. And so with PfCJR, anyone is welcome to become a member. If you would like to be a fellow, that does require some dues, and that goes to just support the mission of the organization and its work. And this is our website, pfcjreform.org. And with that, we will stop the slideshow and just open it up for questions and discussion about what was raised here today. Of course, this was an organization that was founded by physicians, but I do think there's a great deal of overlap in terms of the ethics and the goals with healthcare professions more broadly.
I think people can raise their hands and ask the questions, or type the questions in the Q&A box.
While our attendees are thinking of some questions that they might want to submit, I just saw we have a question that got submitted via the Whova app that I can go ahead and read out for you guys. So someone is asking, do physicians have enough knowledge and training to be able to effectively engage in advocacy? And if not, how can those of us involved in advocacy best help build their capacity?
Yeah, and that's a great question. And I think that gets back to that issue of multidisciplinary collaboration. So for instance, in my role as a forensic psychiatrist, part of what I'm often trying to explain to courts, or the piece that I lend to the conversation, is using that lens of developmental psychology, of trauma, of race and how it impacts people's mental well-being, to help them understand what the implications could be of proposed changes to laws, or to help them understand how that is affecting people's responses and their well-being, or their illness. And so, the goal is not that we become, F. Lee Bailey. The goal is that we take our medical knowledge and what we know, and use that in a way to advocate for a system that doesn't exact as much structural trauma on people. We really see this as a population health issue.
Oh, yeah. And also, I think you all asked like, do our physicians, do we know how to advocate? A lot of times, I would say I went to Morehouse for residency, and before, thanks Dr. Vincent, plug, we had a social determinants type of workshop, and learning how to advocate or talking to legislators and things like that was involved in that. And they would come and talk to us and explain what they do and how we could get involved. And I don't know how many programs do that or have that available to them, but I think that that's something that should be included in the curriculum, because like I said, we do know a lot of we do know research on behaviors and stuff like that, but we don't really know how to advocate. And I don't think I would have gotten that if I didn't go to Morehouse or get involved in forensic stuff or PfCJR. So it may be helpful for institutions to start kind of involving legislators or trying to figure that piece out, because it is important.
I would just echo the comments that Dr. Vincent, Dr. Hoffman said. I had limited advocacy work prior to medical school, and in medical school, I was a part of AMSA, which is one of our collaborators. I learned a little bit how to advocate on the Hill and present white papers and get topics across. But the other thing that I have found when advocating in a congresswoman or man's office is the power of story and the power of individual patients that I carry with me every day, and think about how even with all the tools that one has in a hospital or a healthcare system, that I didn't have all of the tools that I needed to make the change that I wanted. And I think that those pearls, giving those to politicians and people that will never have that experience, right? They won't ever, I mean, they're doing the population medicine, like Dr. Vincent said, they don't have that kernel that we are fortunate enough to have, and to see how that affects our patients, or in both the health that they're not receiving, the health that we want them to receive, and the inequities that we see.
Awesome, thank you. I'm not seeing any questions in the Q&A or any raised hands. So if anyone has another question for our panelists, please, you can type that in the chat. You can submit it to the Q&A, or you can just raise your hand and ask it yourself. Or if any of our panelists have questions for each other to extend the conversation, go right ahead as well.
Well, I would really like to hear who's here, and about their experiences working with organizations like PfCJR, whether they were good or bad, or with physicians in the past in terms of advocacy or collaboration.
Yeah, I'm curious about that too. We could also, while people are thinking, oh, someone maybe raised their hand.
Great, give me 1 second. Okay, I've allowed you to talk and now you just have to unmute yourself from your end as well.
Am I unmuted?
Yes, go right ahead.
Excellent. Hello, my name is Suzanne McKinnon. I am calling from balmy Canada. And I am a social worker, and we are well entrenched in advocacy. And my background is in forensics. And I was very interested in this presentation because I was not aware of physicians having interest, expertise, or participating in this realm at all. So this has been very new information to me. So thank you for the presentation.
No problem. And thank you for attending. So, you know, we have highlighted some of the awesome work that social workers have been doing in Denver with the STAR program, where they've been able to divert, I think it's over 17% of the calls that are to the police to social workers in Denver. And it's a program that's had so much success in 6 months. They were, it's almost like when there's a drug trial and they have such great results that they want to end the trial early and then pump everything that way. That they're, you know, I think they put initially like $1.7 million in for the year, but they already have upped that. So the work of social workers cannot be underestimated. So thank you for all your work, and hopefully we can come up with more programs across the country than just Denver for STAR.
Great. I see another raised hand. Okay, Janet, you're now allowed to talk. You can go ahead and unmute yourself. I think you're unmuted. Can you, did you want to say something?
Looks like she's unmuted.
Maybe her microphone isn't working or something.
Yeah, seems like maybe a little audio issue. If you wanted to share something, feel free to maybe use the chat. I don't think we can hear you.
So we have a question from Issa De Jong. Hopefully I pronounced your name correctly. Why was it decided to create a separate organization, PfCJR, and not a collaborative one with, for example, other organizations or health professionals? I think Kristen probably has the longest institutional memory for the organization. And so I'll let her answer that one. Okay.
Well, first of all, that's a really great question. And you know, the founders would probably be the best, but I can try. So there's a couple of large organization and physician organizations, one of them being the American Medical Association. The other one, unfortunately, is no longer around. It was called National Physicians Alliance, which, not to like give like opinions, but it was a little left leaning and did a little bit more advocacy type work than AMA. And then there was Doctors for America, which was also another organization. And so from what I remember from Dr. Nadam and Dr. Harrison was they reached out to those individuals and they said they were interested, but they weren't going to make it a priority. And as I can probably speak for most people on this Zoom call and Dr. Vincent and Dr. Huffman, it's hard to see things happen over and over again and not think, what am I supposed to do in this moment? Like if I had kids, I don't have kids, but if I had kids or like someone who looked up to me and they said, you know, Kristen, what did you do when all of this junk, we'll just call it junk because I was about to swear, junk was happening, to know that I didn't do anything would be devastating to me. And so if these organizations aren't going to make that a priority, I just don't think that's that's okay. So I think that they were pushed to the limit of current events that made them feel like they had to do something. And if that meant striking out on their own and making an organization of like-minded folks, and that's what they were willing to do. I don't know if I answered that question well, but if you have more that you want to add to it.
Yeah, I do want to emphasize, though, that the organization really does put a premium on collaboration. So it is not Physicians for Criminal Justice Reform because we think physicians have all the answers and we don't want to work with other people. It is us acknowledging that if we say these are our principles as physicians, this issue is in our lane and it is something that we should stake out and be very clear about, that this is part of our work as people who have taken that oath. But it is in no way, and I think I'm channeling the founders here, hopefully, it is in no way meant to be exclusionary, but I'm involved with a lot of organizations, and this is, by far the most sort of collaborative and forward and outward thinking sort of physician organization. So if you're not a physician, please don't think that that means we don't want to work with you and alongside you, because we absolutely do.
Yeah, we worked with occupational health folks in the prison system. We worked with medical students. We've worked with, oh gosh, even people that were police previously and
Attorneys.
Attorneys, yeah. So the name is just the name. It's basically a bunch of people who want to generate change.
I think it's also a way, and I don't know if this is what they're thinking, but it's sort of owning our privilege too, as physicians, and leveraging it intentionally. Sorry. So Stephen Belinko in the chat shared that Physicians and Lawyers for National Drug Policy was housed at Brown University and was very active in the early 2000s. But not sure if they're still active. But I will definitely look. I don't know if Dr. Huntoon or Dr. Hoffman were aware of that organization. I wasn't, but I'll certainly look into it.
Yeah, that's really helpful. One of the things that we've done recently, just to say some recent projects. So we've generated some white papers for different states that we feel like we can make a difference in, and generate just a bunch of data that individuals can use to legislate with. That was initially started with the American Medical Student Association, but we've kind of gone from there. So if you're looking for advocating materials, definitely reach out to us. I'm interested in to hear what other sessions people went to and if there's been any overlap with some of the things that we've been talking about.
Not seeing any
Yeah.
Q&A or comments.
That's good. I'm glad to know that there's not many other organizations like us. If we did, we would definitely need to team up. The one thing that I don't think that we've done, and Dr. Hoffman might be able to confirm this, is we have not, we write to about like prison conditions, especially during COVID, the percent of individuals that, are COVID positive and not undergoing physical distancing and all the testing that they needed. But we also advocate for the mental health of individuals, both prior to incarceration, so that they don't get incarcerated, because prisons are not a place for individuals with mental health disorders to begin with. One of the problems that we have, but one thing that we definitely have not discussed that I remember is training law enforcement, because I know this is law enforcement and public health conference on like us, we have not as physicians gone to educate law enforcement on how they should handle these situations. We've just sent them articles, which may not be the best thing. Do you know of anything, Dr. Hoffman, that I?
Not really. We hadn't actually gotten in. I don't think we've gone to police stations as a organization. I think we understand there's that need there, but actually getting involved that way hadn't been we hadn't been able to do that. We are sort of widespread. One of the things that we have done is we have people who are in different communities who we would say local leaders in those communities to go talk to legislators, things like that. But we hadn't actually come up with a curriculum to talk to police officers and things like that. But we do know it's important to do that and things like that. But we probably should get it and figure that out some piece.
Like, it'd be interesting to do a survey, because I don't know who they learn de-escalation techniques from, or those types of things. Would be interesting to survey. Who's teaching?
Well, one thing,
or is it just teaching police, or is there someone else?
Yeah. Well, we know it's not a lot of that going on, actually. So we did write up an article about the de-escalation practices and how it's used in the United States. And we find that most people get most police get maybe 1% of their training is de-escalation, or they get one training a year, I should say, but they get all these trainings on use of force and all that other stuff. So they do what they're taught to do whenever they get in those situations. If I get taught once a year how to talk to a person like they're human, but get every day I'm interacting with someone or somebody about taking them down and obedience, you need to obey me. That's how I'm going to act when I encounter folks. So we do know that. I think there is I forgot the name of the city in Texas that has tried, which in Texas of all places, which nothing against Texas, but Houston has been known to have the most people killed by cops in, I think, last year. So there's another place in Texas who's on the complete opposite end who use de-escalation, and it has worked out extremely well for them. So it's important for the country to kind of take this on, but it hadn't been anything implemented across the country at all yet, or even doesn't even seem like it's in talks in the United States anyway. So it will be interesting to have that. It'll be good to have that.
And there is a CIT, or crisis intervention training, that's widely used, not universally, but I think it probably is the most popular training. It does incorporate things around mental health issues and things like that. And it's normally co-taught with a law enforcement professional and a mental health professional. I think it's rare that there are physicians that are involved. I will say, though, that CIT is often raised as a sort of remedy or response after people have fatal encounters with law enforcement officers. But there's actually very little to no data that it reduces those things or that it affects the numbers. There is data that it makes law enforcement officers feel more confident, and it increases their perceived competence around these issues, and may increase the amount of mental health referrals. But there isn't data about sort of whether those referrals are racially equitable. There isn't data about use of force, and there isn't data about how it addresses or doesn't address racial inequities in a broader sense either. And the content doesn't actually include those things either. So CIT is there, but it's limited, and definitely is not the be all end all.
Thanks for that. I didn't know that. This is one of the things I love about our organization. I get to learn something along the way. Well, I guess if there's no other questions, maybe we should give everyone a break before their next session. But please reach out to us if you both know of another organization that we should be working with. If you would like to get involved, if you know someone that should get involved, our doors are wide open and always welcome everyone.
Thank you, everybody.
Thank you.
Take care. Stay safe.